So how much IVF should be offered on the NHS? Tonight, health bosses are holding a meeting to ask your views, whether they should reduce the number of cycles offered in parts of Kent from 2 to 1 to cut costs. At the moment, all parts of the county offer 2 cycles, but the NICE guidelines actually suggest 3 should be offered. Well, Sarah Norcross is one of the co-chairs of Fertility Fairness, and Anthony McCarthy is the Director of Research with the Society for the Protection of Unborn Children. They both join us now this morning. Good morning to you both. Sarah, if I could come to you first, do you have concerns that people are going to be asked their views on reducing IVF provision in Kent?
I don't have concerns that they're going to be asked their views, because I think it's good that a clinical commissioning group, when they're considering making changes, goes out to the local community and asks their views. But I am concerned that they're considering reducing already a partial service that they're providing for fertility treatment yet further.
So what would happen in real terms if the number of cycles does get cut from 2 to 1?
Well, it means that people are under more pressure when they're going through an IVF cycle, that, you know, all their hopes and dreams are on that one, I'm sorry, my voice is going, are on that one NHS cycle. And that it's already, you know, a difficult procedure for people to come to terms with and to go through. And that increased, you know, and then what are they to do next? You know, to then, if it doesn't work, to go into the private sector. You know, not everybody can afford that. And do we really want to live in a society where only the well-off can access these treatments and have a family, which is important to everyone, no matter what your income?
And Anthony, as far as you're concerned, how much IVF do you think should be available on the NHS for free?
Well, I don't think it should be available because I think there are serious moral concerns about it. This is the production of new human beings, many of whom are quality controlled or destroyed. So I think there's a big moral question about, you know, how should we be treating human embryos? What happens to them? You know, what is the actual result of widespread practice of IVF? But there's a second question, of course, and that's about priorities, about healthcare allocation, these kinds of things. And I think one thing that's perhaps not so well known, and even Lord Winston, the pioneer here, has expressed concern, and that is that many people are put straight onto IVF, and it's sort of encouraged greatly when lots of issues surrounding fertility have not been properly examined. You know, there can be blockages in tubes, there can be all sorts of areas where people are just told to go straight to IVF. You know, this is heavily promoted, and these other options are not invested in and looked at. And certainly, as I said, Lord Winston has been very concerned about this. So I think there's a huge ethical problem to do with IVF. Treating new human beings, subjecting them to quality control. It's a production process.
And when it comes to money, when it comes to the amount of money, though, that Kent is spending helping people have a family, you're talking about £2 million a year. That isn't actually such a huge figure, is it, when you look at NHS budgets?
Well, I mean, there are many other things where you could talk about £2 million going towards some, you know, good outcomes which don't have the kind of ethical problems that I'm talking about, and actually may well serve fertility better. I mean, this is something that is really, you know, a choice that people make, which I think has some very serious consequences. You have a lot of people working here. I know this, that people working in fertility clinics are very distressed by the very nature of what they do. And you have custody battles with men and women about whether the embryos can be implanted. So you're investing in something that causes an awful lot of problems, and of course, you know, mass destruction of young human beings.
Sarah, you may feel, however, that, you know, there may be moral and ethical concerns when it comes to the well-being and the feelings of people who feel that they may never be able to have a child if it weren't for IVF.
Well, exactly. But I think the thing is that, you know, Anthony, you know, has moral objections to IVF. and that would be his choice not to access it, and people with his views. But people, lots of other people do not share those views, and I don't think the views of one section like that should trump and prevent other people from being able to access these treatments. Anthony's talked about as well about, problematic cases. There is nothing that brings more joy into people's lives than these babies born as a result of IVF. The joy that it brings not just to the parents, but to the grandparents, the aunts and uncles, and their peer support group. When a couple are struggling to conceive and cannot access treatment, as you heard from the caller earlier on, it affects their whole life. They feel socially isolated. You can't necessarily even watch your favourite TV programme as a soap because the character will suddenly become pregnant. All those things just gnaw away at you. It's a visceral, awful feeling for people.
Well, but I think the question is, of course, it's a wonderful thing, people having children, but the question is how are you bringing that about? What do you have to do in order to do that? And you are actually creating, a whole set of children through a production process, and then some of them are quality controlled or destroyed. So, this is something that we publicly are paying for and supporting, and I think, people have a right to say, well, actually, hold on, I'm not sure this is the best thing. Nobody has a right to a child by any means. Children are a gift, and of course, infertility can cause great sadness. And I'm saying, we should look at other options, ethical options, in regard to treatment of that. Many of which are not looked at all, because IVF is a very powerful industry.
And Sarah, can you see that at this time when the NHS is under so much pressure financially, can you understand that this might be an area where West Kent CCG think, okay, perhaps this is an area where funding should be looked at, as opposed to looking at funding into cancer treatment or A&E or something like that?
I can see that CCGs have to review their whole budget, and as you alluded to, the amount of spend on IVF is a minuscule line in their budget. It will be less than 0.5%, sometimes like 0.1% of their total budget. So to think it's going to turn things around is misguided. And actually, if people cannot access in the treatment locally, then they may well travel overseas where the system is less well regulated. Some of the ethical concerns that Anthony's raised are much more serious overseas.
Sarah
and they
Norcross.
come back with multiple births, which cost the NHS more money than they would save.
Sarah, thank you so much indeed. Sarah Norcross from Fertility Fairness and Anthony McCarthy from the Society for the Protection of Unborn Children.